Hello and welcome. My name is Dr. Calliope and I'll be performing your examination today. How are you doing today? Okay. Well, I hope by the time you leave this office you feel even just the littlest bit better. Okay? Alright, so would you mind just confirming your name and date of birth for me, please? Okay, let me get that jotted down. Perfect. And is that the name that you prefer to go by? Wonderful. Thank you. So it looks like we are doing a thyroid status examination today, is that correct? Okay. Is there any particular reason why you wanted us to do this examination? Okay. Wonderful. So I'm going to ask you a few questions before we begin, all right? Firstly, have you had any changes to your medical history that we have on file here? Okay. And what about your family history? Any changes there? Wonderful to hear. Very good. What about your allergies? Any changes? Okay. And what about your medication list? Anything new? Any changes there? Perfect. Thank you. So, for our thyroid status examination today, we're going to be, of course, checking your thyroid, seeing if there's any abnormalities that suggest that we may have to have a closer look. So your thyroid is a little endocrine gland that is located in your neck, okay? In normal people, it shouldn't be able to be felt. But when there's some abnormality, we may be able to palpate it. We might be able to see any masses around this area. And your thyroid gland produces and regulates hormones. So we'll be checking different things that might suggest your hormones are a little out of whack, okay? So I'll be having a look at your hands. I'll have a look at your face and your eyes. I'll have a look, of course, at your neck, your lymph nodes. We'll do some different tests for that, okay? Okay. You have any questions so far? Excellent. And for our examination today, I will, of course, need to be touching you. Is that okay with you? Do I have your consent to do that? Perfect. I appreciate that. Thank you. So, I'm going to set this down. And firstly, I am just going to have a general inspection of you, okay? So I want you to just sit normally, breathe normally, just relax for me, okay? I'm going to step back and take a look. Do you often have any issues with any fidgeting at all when you're trying to stay still? Okay, alrighty. Would you mind just holding out your hands for me and splaying your fingers? I just want to check if there's any signs of Graves' disease, any skin changes here. Okay, I'm going to grab a piece of paper and I'm going to lay it on top of your hands and I'm going to check if there's any sign of a tremor, okay? So if the paper shakes around, we know that there's a tremor there. So, got us a piece of paper here. So I'm just going to place this on your hands. If you just keep them still as much as you can. Okay, so just a very small touch, which is fairly normal. Lots of people have tremors for a variety of different reasons. I myself have a tremor as well. Excellent. Now could you go ahead and just turn your hands back over for me so that your palms are up towards the ceiling? Wonderful. Just looking for any skin changes, any abnormalities. Do you have any issues with any excessive sweating, hyperhidrosis kind of deal on your face, on your hands, anything like that? Okay. Alrighty. So I'm going to take a few notes here. Alright, let's see. So real quick, I'm going to take your pulse and then we're going to take a look at your face, okay? There we are. So, do you have any preference as to which arm I use to take your pulse at all? Okay, I'm just going to default to over here. So I'm just going to be placing my first two fingers on your radial artery right below the base of your thumb on your wrist. So if one were to have hypothyroidism, we could expect that your pulse would be lower than normal. And with one with hyperthyroidism, we could expect that you would have a higher pulse than normal. But so far this is feeling steady and even. Okay, alrighty, you can go ahead and relax your hand. Alright, so that was well within normal limits. No issues there. Okay, so I'm going to have a little look at your face, okay? Looking for any skin issues there, or even, oddly enough, if you have lost the outer third of your eyebrow, that could be a symptom of a thyroid issue. Isn't that kind of interesting? So I just want to make sure that you have your full eyebrows and that not having any evidence of dry skin or sweating. That all looks very normal to me. Okay, so I'm going to have a little look at your eyes now. So I'm going to look at your eyes here from the front, and then I'm going to look from each side as well. And I'm also going to be looking at you. I'll be behind you and you'll look up for me, and I'll look down at your eyes, okay? Just to see if there's any protrusion of the eyeballs. Okay, I'm going to come to the side and just take a little look here. Okay, and I'm going to go ahead and go to the back. And I want you to look up for me. Okay, very good. And you can go ahead and look normally, straight ahead. And I'm going to look from the other side over here. Here we are. Okay, I'm going to come back around. Okay. No signs of any protuberances. I'll take a couple notes and then we'll do some eye movement testing. Okay. So now we're going to do a little test that is known as the H test or the follow the finger test. So I'm going to have my fingers up here, and I want you to follow my fingers using only your eyes without moving your head, okay? So I'm going to step back, and then I want you to just follow follow my hand movements, rather, with your eyes, okay? Right. So, go ahead and just follow the fingers for me. Follow the fingers as best as you can. Follow my fingers. You're doing really well so far. Go ahead and just keep following my fingers. Just looking for any restriction and eye movement, any lag, any delay. Okay, just keep following my fingers. Follow the fingers. Okay. Very good. So now I'm going to check for lid lag. And I want you to keep following my fingers using only your eyes without moving your head. Just back and forth. Up and down. Okay. Alrighty. Excellent. So let me just write that down. Quite pleased with that. Okay. So now I'm going to have a little look at your neck. I'm going to be inspecting it. We're going to do some palpation. I'll ask you to take a sip of some water that I have over here, okay? It's fresh water. Don't worry, I got it straight out of a new bottle when you came into the office, okay? Alrighty. So I'm going to first just have a little look. So I want to make sure that there aren't any skin changes that I can notice. I want to make sure there aren't any scars or any evidence of any masses. Alrighty, so as I said before, I have this little bit of water here. Green cup, okay? Green disposable cup, not green water. So I want you to just have a little sip of this water, please. Okay? And then I'm just going to have you hold that in your mouth. And then as I'm watching your neck, I want you to take a swallow, okay? Very good. Excellent. So now I'm going to have you stick out your tongue for me, okay? Just like that. Just keep your tongue stuck out. Okay. Very good. You can go ahead and put your tongue back into your mouth. I'm going to take some notes while I am right in front of you. Because in just a second, I'm going to be going behind you to palpate everything, okay? Okay, very good. So, while I'm behind you, I'll need you to take a sip of the water again, okay? I'll let you know when that time comes. I have it just right here, so when you need to, you can just grab it from the table, okay? Alrighty, so I'm going to go in the back of you. I'll be right back. I'll tell you what I'm doing, where I'm at, okay? Right. Alrighty, so now we're going to be palpating your neck. So I'm going to start at the Adam's apple and just work around to the cricoid cartilage and then down to the isthmus of the thyroid gland. In a normal, healthy individual, I really shouldn't feel too much at all. Okay, can you go ahead and stick your tongue out for me? Okay, you can put it back. And can you take a sip of that water for me and swallow it? Okay, very good. So now I'm going to be palpating your lymph nodes on the neck as well. Okay, around your neck and your clavicle area. I want to make sure there isn't any swelling at all in any of these areas. Okay. Now I'm going to go ahead and palpate your trachea. This might be a little uncomfortable, okay? Just warning you right now. Might be a little firm. Okay, very good. So I'm going to come back around. Okay, so I'm going to grab my stethoscope. First, I'll do some percussion on your chest, and then I'm going to take a listen for any thyroid bruits, okay? Alrighty, so first we're going to percuss your chest here, okay? Very good, and then we'll do some auscultation. So a bruit is an audible heart murmur. And I'm just going to be listening if there's anything out of the ordinary when I take a listen around your thyroid. So I want you to take a deep breath in for me and hold it, okay? Deep breath in and hold while I just take a little listen to any bruits in the neck. Okay, go ahead and exhale and breathe normally, okay? Alright, so we're going to do a few last tests for you, okay? So firstly, I want to check one of your reflexes. I have our reflex hammer here, and I'm going to have you relax your arms, okay? If you want to just rest those on your knees and relax them. Okay, and I'm going to be putting my thumb in the crook of your elbow, and then I'm going to be tapping on my thumb with the reflex hammer, okay? Alright, so I'm going to grab your elbow here and just tap, tap, tap. Okay, and now the other arm, grabbing your elbow and putting my thumb in the crook of it, tap, tap, tap. Okay, very good. So lastly, I want to check your shins for any signs of Graves' disease, and then I'll have you do one last little test for me, okay? So if you could just roll up your pant legs so that I can see your shins. Okay, and I'm just going to duck down real quick and take a look. Alright, so the skin here looks normal, clear, not noticing any skin changes, any masses. So that's good, there's nothing out of the ordinary here. I'm going to pop back up. And then lastly, I'm going to have you cross your arms over your chest, and then I'm going to have you stand up for me, okay? Let me give you a touch of room. Okay. Alrighty, you can go ahead and sit back down, okay? Excellent. So I'm going to grab my notes. And I'm just going to jot down all my little comments about what we examined here. So, that concludes your thyroid status examination today. I didn't find absolutely anything out of the ordinary. I don't think we'll need to do any further testing, okay? You're not showing any signs of any thyroid disease, so that's really good, okay? Do you have any questions or comments for me at all? Okay, very good. So I'm going to sign off on your chart here. Very good, and you are all free to go. So thank you so much for coming into the clinic today and seeing me. I really appreciate it. I hope that you have a whale of a day and a good rest of your night, okay? Thanks for coming in. Goodbye now. Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe